Welcome. If you're watching this video, it is likely that you or a loved one is preparing for a CT-guided biopsy. We understand you may be feeling apprehensive and hope that this guide helps by allowing you to learn more about the process before your appointment. A CT-guided biopsy is a minimally invasive procedure that allows doctors to obtain a small sample of tissue from one of the organs in your body. This helps diagnose various conditions including inflammation, tumours and sometimes even infections.
Hello, morning. So I'm Estelle, one of the nurses.
Your doctor may recommend a biopsy if imaging tests like X-rays or CT scans show an abnormality somewhere in your body. Most commonly, we take biopsies from kidneys, lungs or lymph glands, but we can take biopsies from many different parts of the body. The biopsy helps in making an accurate diagnosis so that we can decide on the most effective treatment for you. Before your biopsy, you may be asked to stop certain medications, usually blood thinners. Make sure to follow these instructions carefully and stop only those medications we ask you to stop, whilst continuing to take your other medications as normal. It is especially important to continue your blood pressure medication in order to ensure that your blood pressure is controlled on the day of your procedure. On the morning of the procedure, you may have an early, light breakfast and you may drink as normal. Hi Rolly.
Good morning.
My name's Arzu Rezvani, I'm one of the radiology consultants. Once you arrive in the department, you'll meet the radiology doctor before the biopsy. They will explain the procedure to you in detail and you will have the opportunity to ask questions or communicate any concerns or worries you might have. Please tell us if you or anyone in your family has ever experienced prolonged bleeding after a medical or dental procedure, and bring in your regular medications with you, even those you have been asked to stop taking for the biopsy.
So my name is Bibin, one of the radiographers, and I am working with Renju.
For the procedure itself, you will have changed into a gown, a cannula will be sited in your arm, and then you will be taken to the CT scanner bed. Exact positioning will depend on the location of the abnormality, but we will spend some time ensuring you are comfortable. This maximises the chance of a successful biopsy by enabling you to lie still throughout and to reduce the chances of you needing to move. Are you comfy now? You don't need anything under your knees? Yeah? Okay. So once we've done this, as still as a stone for me, and remember those breathing instructions. All right, let's go. The radiology doctor will start with a planning scan to work out where on the skin the biopsy needle will be inserted. Can you put that on the... And after this, that area is cleaned and numbed with a local anesthetic. The local anesthetic stings when it first goes in, but this stinging only lasts a few seconds. After the stinging wears off, you shouldn't be able to feel any painful sensations, but you will still have other sensations like touch or movement. If you do feel anything painful or sharp, please tell the doctor straight away and they will give you more local anesthetic. After the planning scan, a series of very tiny CT scans will provide images that help the doctor to position and move the biopsy needle to the precise location that the biopsy will be taken. Did we do that on a breath hold, Rolly? During every scan and whenever the doctor moves the needle, you may be required to hold your breath. But don't worry, as this will only be for a few short seconds each time. Once the needle is in place, a few tiny samples of tissue are collected. You might hear some clicks at this point. After the radiologist has collected enough samples, they will remove the needle and place a sticking plaster over the biopsy site. Being a minimally invasive procedure, you will only have a very tiny cut in the skin, just a few millimetres long, and this will heal in a few days. These biopsies are usually very well tolerated and shouldn't be very painful. In fact, for most patients, the most painful part is the local anesthetic injection. The procedure takes on average about half an hour, and when it's finished you will be transferred back to your bed in the recovery area for monitoring.
We're back in daycare now, so all you have to do is just chill out.
This monitoring or observation period takes 4 hours for abdominal biopsies, 2 hours for chest biopsies, and allows us to ensure there are no complications. You will also be able to have something to eat and drink as you recover, and you may want to bring a book or something to listen to pass the time. Most people will go home after these 2 to 4 hours, but if you develop a complication, you may have to stay longer. On rare occasions, you may need to stay with us overnight, so please do bring some overnight essentials just in case. When we discharge you home, we like you to have someone to support you for the first 24 hours. If you live alone, you should arrange for a relative or friend to stay for the first day and night. It's important to take it easy for the first couple of days after a biopsy, but you'll soon be back to your normal levels of activity after that. If you have had to stop any blood thinning medications, you should restart these the next day. Like any medical procedure, a CT-guided biopsy has some risks. These risks include bleeding, infection, and injury to other structures. These will be explained to you carefully to ensure you understand them before starting the procedure. But in the meantime, it is important to remember that we as doctors only advise any investigation or treatment when the benefits clearly outweigh the risks. You should also be reassured that we take steps to minimise these risks to as low as we can get them, and that we are well prepared to manage any complications. Your biopsy results will usually be available within 1 to 2 weeks. Your doctor will discuss the findings with you either in clinic or by telephone and explain the next steps, whether it's further treatment or additional tests. We hope this video has helped you understand what to expect during your CT-guided biopsy. If you have any more questions or concerns, don't hesitate to contact your doctor or specialist nurse. See you on the day.